Hello everyone, hope you're all doing good. In this video, we are going to discuss about fourth trimester. So we all know pregnancy is divided into 3 trimesters. Now what is this fourth trimester? Yes, after delivery, the puerperal period also has its own importance. So it is also to be monitored and the conditions and complications arising in that should also be treated. So let's go into the fourth trimester topic. So the fourth trimester ideally, this is the time following delivery in which the maternal anatomical and physiological changes are going to revert slowly back to its original state, right? So, when we talk about the definition, time following delivery in which pregnancy induced changes, okay, namely the physiological and anatomical changes in the mother, okay, revert to the normal range or the non-pregnant state. Clear? Right. So this period is usually considered after delivery of the placenta till 12 weeks. Okay. So this is further divided into immediate puerperium, which is up to 24 to 48 hours. Then early puerperium, which is up to 7 days, and late or remote puerperium, which is up to 6 weeks. Okay. So this is how we divide that. So what are we going to have as a component of this puerperal period or the fourth trimester? Okay. So when we see the components, you have to know that there is a need of postpartum care for the mothers during this period. You have to advise them on postnatal visits as well. There will be lactation problems and breastfeeding problems, okay, that has to be addressed, and plans and advice should also be given. Then contraception and sterilization advice and counseling should also be done. Sometimes there can be any complications that is arising out of pregnancy in the puerperal period. Then there can be issues with the mental health of the mother, as well as there can be any chronic conditions that is associated with the mother which can get exaggerated in the puerperal period. Clear? Right. Now, we'll see about the anatomical changes that is happening in the puerperium first. Okay. So, first thing is about the reproductive tract involution. So, when we see, the most important organ we have to discuss is about the uterus. So, uterus usually after delivery, the fundus is going to lie just below the umbilicus. Okay. So, fundus lies just below the umbilicus, right? That is soon after delivery, right? Then what is going to happen is both your upper and lower segments are going to contract and retract. Okay. So contraction means it is going to get compact. Retraction means the myometrial cell size is going to become less. Okay. And here all these actions will be more in the upper segment when compared to the lower segment. Okay. So, after few days, this upper segment will be barely visible and it will be converted to a barely distinguishable isthmus, right? Now, another important concept you have to know is the weight of the uterus after delivery. Okay, so soon after delivery, the weight is going to be around 1000 grams, right? Then by 1 week, this is going to reduce by half and there will be only around 500 grams of weight. Okay, and by second week, this will be around some 300 grams and by 4 weeks, it is going to be around 100 grams, right? So, you have to know, as I already told you, only the myometrial cell size is going to reduce. Clear? And you have to know that by 4 weeks, the clinical involution will be complete. Okay, by this time, clinically, the uterus can appear involuted, but still, when you check through ultrasonogram, the total reverting of changes back to the normal state will be happening only by around 8 weeks. Clear? Right. Now, we'll pass on to the next important concept, that is endometrium regeneration. Okay. So, endometrium in pregnancy is nothing but the decidua that has been shed off along with the placenta after delivery of the fetus. Now, this endometrium has to regenerate and this will be usually completed by 10th day post-delivery. Completed by 10th day post-delivery and it arises from zona basalis. Right? Okay. And the next one is, we have to know what is the ultrasonogram findings. So, USG findings include uterine involution and there is reduction in uterine volume as well that can be measured, right? And also, it returns to pre-pregnant state in ultrasonogram. When you will be able to find it? Yes, around 8 weeks. Third point is complete involution in multiparous takes longer time when compared to the primiparous women. Okay, and also if she had cesarean section, then definitely at this site the myometrium thickness is going to be more, right? So, in cesarean section, myometrial thickness over the incision site is more. Clear? Okay. Now, you have to know one important concept, that is after pains. So, what is this after pains? After pains is something that happens when the uterus is going to tonically contracted after delivery. Okay. So, this is somewhat similar to labor contractions and it is seen more with increased variety as well as breastfeeding. Can you guess any answer why it is increased during lactation period or breastfeeding? Yes, because there is a increased release of oxytocin with nipple stimulation. So, usually this becomes mild by third day. Suppose if it persists, after pain is persisting means then you have to think about any infection, right? Okay. Now, we will pass on to the next important concept, that is about the lochia. Okay. So, lochia is basically nothing but the sloughing of decidual tissue. Okay. So, this is going to contain components like the decidua, which is shredded. Then you will have erythrocytes, epithelial cells and bacteria and so on. Okay. So, when you speak about lochia, it is divided into 3 types again. So, lochia is divided into 3 types, and remember one more concept, that lochia will be coming out through the genital tract for about 24 to 36 days. Clear? And when we see the different forms of lochia, they can be lochia rubra or lochia serosa or lochia alba. Right? Now, lochia rubra is usually red in color because rubra means red, and this will flow for around 1 to 3 days. Lochia serosa will be flowing for about 4 to 10 days, and this will become somewhat pale red in color. And lochia alba, which is going to be white or yellow white in color, okay, flows after 10 days, okay, after completion of lochia serosa flow and till we don't know, either 24 to 36 days, right. So, this is all about lochia. And another important concept I want to talk about in the uterus is, you have to know that there is a placental site, right. So, this placental site involution also plays an important role in the puerperium, okay. So, placental site involution. So, usually after delivery, the placental size is going to be palm sized, okay. So, from second week, this is going to measure around 3 to 4 centimeter in diameter. So, if you see, there is a process of exfoliation. That means there is sloughing, and this will be accompanied by remodeling as well. Clear? Okay. So, next we will see about the cervix. Cervix, external os may be lacerated, and the cervical opening is going to contract slowly, right. So, what happens by the end of first week, okay, the opening is going to narrow further, and opening narrows further, there is thickening of the cervix as well, and there is formation of endocervical canal. Clear? So, these cervical lacerations, okay, the cervical lacerations that has happened during delivery become ectocervical depressions, and they are going to be permanent as well, okay. So, if you see, the nulliparous cervix is going to be having a round opening, whereas multiparous cervix is going to have a opening like a transverse slit with numerous ectocervical depressions. Can you understand? Yes. So, if you take the nulliparous cervix and multiparous cervix, you will be having a round opening in nulliparous cervix, whereas in a multiparous cervix, it is going to be a transverse slit like this, and you will be having numerous depressions also. Clear? Right. So, we'll see about the vagina. See, vagina is also going to gradually diminish in size, and returning to nulliparous state of the vagina is mostly rare. If you see, rugae of vagina can be seen from 3rd week, but returning to pre-pregnancy state is not that much common. Okay? And the changes in the hymen also you have to know, what is very important. Hymen is represented by small tags of tissue after delivery that will be forming a scar, and it will be known as myrtiform caruncles. Clear? Now, we'll see about the changes in the urinary tract after delivery. So, normally what has happened during pregnancy? There was glomerular hyperfiltration, right? Glomerular hyperfiltration. Now, this can persist up to 2 weeks after delivery. So, what happens is, mostly due to the hormone progesterone, there is dilatation of ureters, renal pelvis also, and usually this will return to pre-pregnant state after 2 to 8 weeks. Clear? And when you see through cystoscopy, you will be able to see that there is various amount of submucosal hemorrhage and edema that is present in the bladder. Clear? Now, you have to know one more point, that in bladder there is greater capacity as well as relative insensitivity, insensitivity to the intravesicular pressure after delivery. Clear? Right. Now, we will see the changes about the peritoneum and the abdominal wall also. So, what happens in the peritoneum and abdominal wall? So, we know the broad ligaments and round ligaments are going to stretch, and they would have been loosened during pregnancy, and this generally needs time to recover. Second one, have to know about the abdominal wall. After delivery, the abdominal wall is generally soft and flaccid due to rupture of the elastic fibers of the skin. Elastic fibers of the skin. Because there is constant distension of the abdominal wall muscles also, as the gravid uterus was keep on expanding throughout the pregnancy. Okay. Then, know that these can be managed by abdominal binder or exercise. Okay, these are the two options you have to correct this. And if it is a vaginal delivery, it can be started anytime after vaginal delivery, but if it is a cesarean section, you have to start it after 6 weeks. Clear? Right. So, sometimes most of the women will be having, repeating. And what happens is, the striae in the abdomen will become silver in color. Okay, and it can persist as striae gravidarum. Clear? Yes. Next we'll see about the blood and blood volume changes. So blood and blood volume. In the puerperal period, there is marked thrombocytosis and leukocytosis up to 25,000 cells per microliter can also be seen, and especially granulocytes are there. And then there is relative lymphopenia and a state of absolute eosinopenia. Yes. Then hemoglobin and hematocrit would have been decreased moderate levels. Okay. If they fall below the pre-pregnancy levels, then you have to assume that there is a significant amount of hemorrhage that has happened during delivery, right? Then cardiac output, heart rate and blood pressure are going to remain elevated at least for 28 to 48 hours postpartum, and all these things will be reverting back to normal state by 10 days. Clear? Okay. Then blood volume is going to return to the pre-pregnant state by 1 week postpartum. And remember, the SVR, systemic vascular resistance, that has reduced during pregnancy is going to rise after 2 weeks postpartum. Okay, and steadily rise till it reaches the pre-pregnancy values. Clear? Right. Now, the next important concept that most of the puerperal mothers worry is about the weight. So, when you see the changes in weight after delivery, there is physiological reversal of the increased water and sodium retention. Okay, and this will be leading to puerperal or postpartum diuresis. Okay, so this itself will be helping in losing a weight of 2 to 3 kilogram naturally after delivery. Clear? And you know already that around 5 to 6 kgs of weight has been lost with the delivery of the fetus, placenta, okay, and the blood loss after delivery. Clear? Any residual weight that is left apart from this weight loss is going to be due to fat storage. So, mostly after 6 months pre-pregnancy, weight is achieved. Clear? We'll see the next one, that is about the hospital care. So, hospital care is needed for first 2 hours after delivery, by which you will be monitoring the patient by measuring her BP and pulse rate every 15 minutes once. Okay. Then temperature should be monitored every 4th hourly up to 8 hours. Then you can change it to measuring it every Q8 hourly. Clear? Right. Then you have to ensure the uterine fundus has been contracted. If needed, uterine massage, fundal massage can be given. Okay. And then you can even measure SFH. SFH is symphysiofundal height, okay, from the symphysis pubis to the uterine fundus, okay. So this height can be measured using a regular tape, which will help in diagnosing of collection of any bleeding that is happening inside the uterus, okay, because as the blood collection is going to happen inside the uterus, inside the uterine cavity, the uterus is going to expand, right. So as you measure serially the SFH, it is going to increase if there is any collection inside the uterus. Understood? Yes. And the next one is, you also have to know the advantages of early ambulation in case of delivery. There are advantages like you have fewer bladder complications, there is less frequent constipation, it reduces the rate of DVT as well as thromboembolism, there is reduced rate of pulmonary embolism as well. Clear? Right. And you have to know another important point, diet is not restricted in case of normal vaginal delivery, okay. While lactating, suppose if the woman is lactating, then her calories and proteins should be increased. And don't ever forget to tell her that she should continue her iron and folic acids for 3 months in the puerperal period also. Clear? And she should have a minimum of 2 postpartum visits, one at 3 weeks and second one at 12 weeks. Clear? Yes? Right. So, you have to recheck the hematocrit after the delivery during her first visit, okay. Now, there can be intestinal paresis also. So, intestinal paresis can lead to increased thirst and constipation as well, right. One important care that you have to provide to the mother in the puerperal period is perineal care. So, when we see about perineal care, you have to instruct the woman to clean the vulva from anterior to posterior region. Suppose in the first 24 hours, if there is any perineal laceration or episiotomy she got during delivery, then a cool pack can be applied, okay. So, that will reduce the edema as well as discomfort. Clear? And the next point is, after 24 hours, you can provide her warm sitz bath for pain relief, okay. Sitz bath means you have to ask the patient to take a basin in which warm water will be poured. In that warm water, you can add some solution like betadine solution or something, right. If you see the episiotomy wound, this becomes mostly asymptomatic by 3rd week. Clear? Sometimes if there is any discomfort or pain that is increased in the episiotomy site, then you have to know that there is infection. Clear? Right. Now, some more points. You have to know about immunization also. So, if the woman is D negative, then you have to give anti-D of dose 300 microgram soon after delivery ideally, or within 72 hours. Okay, but it can be given up to a period of 28 days. Clear? If she is not immune to rubella or varicella, then this vaccination can be completed just before her discharge. Okay, and you have to know, you have to give her Tdap, TD, or influenza vaccine, or even COVID-19 vaccine. Yes, right. Then you will see contraception. Okay, so contraception means what you have to do is you have to provide the women about family education. That is very important. Usually, resumption of ovulation anytime after delivery will be accompanied by resumption of menstruation as well. Clear? So, if you see in the lactating mother, resumption of ovulation takes place around 10 weeks, and you have to start contraception for this kind of woman from third postpartum month. Clear? This is one point. And suppose if she is a non-lactating mother, in her the ovulation will seem to resume around 4 weeks itself. Okay, so ideally by third postpartum week itself you would have started contraception methods. Clear? Right. Now, what are the ideal methods of contraception for a postpartum woman means? You can give them levonorgestrel, IUCD, or levonorgestrel implant, or you can even advise her dipeptidyl acetate, or finally you can advise her progesterone only pills. Okay, so this is in the order. So this is your first option, second option, third option, and fourth option. Okay, you have to counsel the mother and you have to let her choose the best for her, right? And then coitus, if any question is asked about coitus, this can be resumed after 2 weeks. Clear? So in this video we have learnt about puerperium, what is puerperium, what are the normal physiological and anatomical changes that is going to take place, and we have seen some perinatal care also. So until we meet in the next video, keep going, happy learning and take care.